Hello, and welcome to another edition of Hey Amenda, where we have Dr. Veer here with us. And of course, as requested by a lot of people, we're going to talk about vitamin D. It's something that we use in our clinic a lot. It's something that we test for when we send you out for labs. People are wondering, why do we do that?
Why do we test for vitamin D?
Yeah.
So vitamin D is one of the vitamins that we need to have provided to our bodies from an external source in order to be a person. Your body needs your vitamins in order to do most of its biochemical stuff. Vitamin D is usually made in our skin when we're outside and getting certain types of UV light. And people who live in the Pacific Northwest, like us and most of my patients, don't get the right type of sunlight for half the year, partly because of cloudiness and partly because of the tilt of the earth versus the sun and the types of rays that can get through the cloud layer to us. So I test almost everybody for vitamin D to know, like, are you deficient? Do you have too much? It is possible to have too much, usually from over supplementing. Most people are deficient. And I see a big correlation between not having enough vitamin D levels and having like low energy, poor cognition, and depression. So I'm coming at it from a mental health lens of like people walk in my door virtually to get help with depression and anxiety. And so I run these nutrient labs to see, are we missing anything that's really fundamental that your body needs? Vitamin D is one of those fundamentals.
So we see here in the Pacific Northwest, it's more common to have a deficiency. And can a person just go to the store and get vitamin D? Obviously, it's one of the most popular.
Yeah.
What is our thoughts on bioavailability and what kind of supplements we're going to look for?
Yeah, so vitamin D is really easy to find over the counter because people have known for a while how essential it is. There are different types of vitamin D, and at this point, vitamin D3 is the one that you're going to find most commonly. That is the most bioavailable version. In my youth, vitamin D2 was the easiest one to get because I guess it's easier to manufacture. I don't know for sure. And D3 is the version that your body is able to use best. There is a lot of disagreement between how much is the recommended daily allowance of vitamin D and how much is actually useful in the research to support like depression, to support immune function. So dosing is going to vary widely when you're looking at over-the-counter vitamin D supplements. I usually recommend that people get either gel caps or liquid because it's going to be in the format that your body can take it in most easily when it's mixed with an oil or like oil-based.
I prefer the chocolate chewables.
Yes, those are delicious. I really like those ones too.
Yeah, absolutely.
And like whatever makes it easier for you to take your stuff, like we'll roll with that. But sometimes we're looking for bioavailability, and sometimes we're looking for deliciousness.
And our functional lab's really going to be the way that we gauge that. So we're going to test, we're going to start you out with a protocol, and we're going to follow up with more labs to find out if your body is absorbing it, utilizing it.
Yeah. So I usually run a vitamin D as part of intake labs with somebody because I expect almost everybody in this region is going to be deficient. But also we want to run vitamin D labs regularly if you're taking a vitamin D because it's possible to overdo it and get too much vitamin D, which will make you sick. So I usually run that lab about once a year because that's how often insurance likes to cover it. Sometimes I'll do it more often if I'm really worried that you're super deficient and we're trying to like get that number up quickly.
Yeah, from the insurance piece, it is one of those that they only like to cover it once a year or for very specific diagnoses that are unrelated to mental health. So that's one of those that thank you to the labs that we work with for having affordable functional labs that people can do more often if they need to.
Yeah. We have ways of ordering vitamin D labs if insurance isn't covering it that won't like break the bank. But generally I get people at whatever level is sustainable for them, and then we sort of set it and forget it. It's not one of the ones that we need to monitor like we do with some other nutrients or medications.
And then once we get them to that functioning level, so we said we see, you know, positive benefits for depression. Is that just a part of the picture? Obviously, we have other things that we're going to be addressing where depression is concerned specifically.
Yeah.
But where can we see that kind of daily benefit?
Yeah. So vitamin D is one of many nutrients that I look at when somebody walks through my door. And I have never been in the position where vitamin D is the one treatment that solved all of the problems.
Darn.
I know, that would be really nice. But I often find that people, once we get their vitamin D level up, just like the baseline of where their mood can get is up a little bit. They're a little more resilient. And there's some like subtle benefits that they may notice in cognition too. Like it may be easier to think if their vitamin D
always a win.
Yes. Yeah, totally. I'm usually using vitamin D as part of a protocol. Like we're testing a bunch of other nutrients, we may be starting a medication. So I have yet to have a clinical opportunity to do like just vitamin D and nothing else and see how that goes for somebody. But I had one patient who took a high dose vitamin D because we were trying to get it up real fast. And she noticed a big difference that day. And that has always sort of stuck in my head of like, some people are going to feel a big difference when we're able to get their vitamin D up quickly. And some people, it's just going to be subtle. They're not going to notice much. And that's just like, that's par for the course.
And next week, I think we should talk about that dump that happens when you finally support your body, because there's this kind of misinformation around, we're giving our body something it's been deficient in, shouldn't it feel better? And it's a little bit more complicated than that.
Yeah, there's a lot of things that go into that. And we should definitely do a Hey Amenda about that at some point.
Perfect.
Cool.